Hello, everyone, and welcome to Heads Up, the official weekly podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am here today with Dr. Vince Martin. Hello, Dr. Martin. How are you?
Good. How are you?
Good. Dr. Martin is the director of the Headache and Facial Pain Center at the University of Cincinnati, and he is also the president of the National Headache Foundation. Dr. Martin and I are often on here talking about very interesting and relevant things that are pertinent to all of us with headache disorders. And today we are going to talk about vestibular migraine. So without wasting any time, Dr. Martin, vestibular migraine is technically classified in the ICHD-3, which is the International Classification of Headache Disorders, as a syndrome that may be associated with migraine. Can you tell us a little bit about what vestibular migraine is?
Well, vestibular migraine are attacks of vertigo where you develop spinning of the room or you feel like you're moving in relationship to the room in patients that have migraine headache. And when they have attacks of this vertigo, about half of them or more will either have a frank migraine with the vertigo, or they'll have just what we call the associated symptoms. That means they'll have like sensitivity to light or noise or other migraine symptoms with these attacks. So it's not an official diagnostic criteria, but it's one that's been proposed for diagnostic criteria by the International Headache Society.
Okay. So can you talk to us a little bit about the difference between dizziness and vertigo? Because I think a lot of us with migraine experience dizziness, but we might not necessarily experience vertigo. It's a little bit different. Can you talk about that?
Well, dizziness is kind of the overall category that people have. So dizziness could either mean that the room is spinning around, like we just described with vertigo, or it could be a sense of being off balance.
Mm-hmm.
Or in some cases, people will describe dizziness as lightheadedness, like they're going to black out. And some people will then describe dizziness as kind of veering off to one side. So they'll like walk into a door or something like that. So, and there are various different categories of dizziness. One would be vertigo, we talked about. The other would be something called ataxia. And ataxia is kind of where you're uncoordinated and fall to one side when you walk. Mm-hmm. And then the third category would be dizziness, where you're going to feel like you're going to black out. And each one of these categories has different diseases that are associated with it.
Okay. Are there any other causes of vertigo besides migraine?
Oh, there's a multitude. You can have diseases of the inner ear. You can have something called Meniere's disease, where you have hearing loss and vertigo, and that is associated with migraine as well. Mm-hmm. There's another disorder called semicircular canal dehiscence, where the little seashell in your inner ear that kind of perceives, which way you're turning your head, kind of becomes diseased, and that can cause vertigo. I mean, there literally are a multitude of different causes. You can have different disorders of the brain that can do it as well. So there are many different causes of vertigo, and just because someone has vertigo and migraine doesn't necessarily mean that they've got vestibular migraine. That's kind of a diagnosis of exclusion. So exclude everything else, and then if they have migraine and vertigo and they have these symptoms that resemble migraine in more than half the attacks, then they may have vestibular migraine.
Okay. I feel that there's a little bit of a lack of understanding in our community regarding how severe these symptoms can be. I've had people explain to me when they have vestibular migraine that it's like they're living their life in a fun house, except it's not fun. They say that they can't walk anywhere without like putting their hand on a wall to guide them. Someone recently told me that she felt like she was always walking on huge marshmallows, which I thought was so interesting. So can you explain to me what it feels like for these people?
Well, all I can describe is what people tell me. Some people will describe, the vertigo is like a kaleidoscope, like the room moving like a kaleidoscope. Some people will tell me that they feel like they're always on a boat, and the room is moving continuously. Some people will say that they feel like they're drunk, like if they were to be picked up by a police officer, that the police officer might think they had been drinking when
Oh, wow.
in reality they had not.
Right.
So there's a variety of different ways. People can be really disabled by this. If you have both migraine and vertigo, I mean, that's like the quadruple whammy. It's like you've got all the symptoms of a migraine, and on top of it, you've got vertigo. It's very disabling. Some people, can have difficulty getting out of bed when these attacks occur.
Okay. What I find most interesting when I talk to people with vestibular migraine is that often their symptoms of vertigo may come without any head pain. Is this common?
Absolutely. You don't even have to have migraine symptoms. As long as a certain percentage of the attacks have migraine symptoms, then it could meet criteria for vestibular migraine. But the specific attacks of vertigo could come without any head pain and without any migraine associated symptoms.
Okay. Are there any diagnostic tests for vestibular migraine that people might undergo?
Well, usually what happens is if you've got a real severe case that does not resolve after several weeks, oftentimes you get referred to an ear, nose, and throat doctor, and they'll do a variety of tests, vestibular tests. They put different like warm water in your ear, and they do different tests where they try to induce dizziness, and they can kind of tell where in the brain that the dizziness is coming from in many instances.
Okay. So what are some of the tricks to treating vestibular migraine?
Well, once you've done all the testing, and even in some cases, you may even need to do an MRI of the brain to exclude different brain disorders that can cause dizziness.
Mm-hmm.
And if the criteria are consistent with vestibular migraine, then oftentimes we'll put people on migraine preventative therapies or preventive therapies,
Mm-hmm.
like either daily medications or shots that prevent migraine, with the thought that it might help vestibular migraine as well. The problem is there are not great studies looking at treatments for vestibular migraine. Most of them are just case reports of 10 or 15 patients that were tried on this migraine therapy versus that, and it seemed to improve the attacks of vertigo as well as the migraine. My experience is that if you get people on a reasonable migraine preventative therapy, if it's vestibular migraine, it often responds to therapy. It doesn't completely get rid of all attacks of vertigo, but you could substantially decrease the attacks by treating with migraine preventive therapies. And this is something a lot of physicians don't recognize. Even some headache doctors don't recognize this as a potential therapy for some patients with vertigo.
Okay. If someone's watching today and they feel they may have vestibular migraine and they either have never been diagnosed or they're wondering what type of provider to go to, do you have any advice for them?
Well, if I see a patient with vertigo and migraine, the first thing I do is, before I even refer, would be to send them to vestibular therapy. So there are certain physical therapists that have special expertise in dealing with vertigo patients.
Okay.
So that would be the first step. And then if they don't respond to that, then I'll usually refer people to an ear, nose, and throat physician that has special expertise in vertigo. And not all ENTs have special expertise in vertigo. And then they can do all the different diagnostic tests, determine if there's anything that's suspicious for disorders where you would need an MRI of the brain. And there could be other specific therapies. They might diagnose Meniere's disease or some of these other causes of vertigo.
Okay. Is there anything else that you think people should know about vestibular migraine before we go today?
Well, I think that it's an under-recognized cause for vertigo and for dizziness. And I think that it needs to be considered by physicians and patients alike. And I think you need to realize there can be some therapies that can be given to decrease the frequency of these attacks if it is vestibular migraine. So I think there is hope out for people for this disorder, and we just need to inform patients and physicians alike at how to manage it.
Okay, so we would like, before we go, we would like everyone to know that the National Headache Foundation does have a toll-free number that you can call if you have burning questions about your headache disorder. You can call 888-NHF-5552. That is 888-643-5552. And you can tell them what your question is, and the National Headache Foundation does their best to find you a good answer. So feel free to call that number, and you also always can leave questions in the comments of the Heads Up podcast. So please join us again next week. We hope you enjoyed this episode on vestibular migraine. Good night.